each introduce themselves, but the number of participants we have this time, which is wonderful. We're so happy to see so many of you join up, means that it probably will take too much time to do that. So what I want to ask you to do instead is if you can write your name and where you're working in the chat, and just share what is your motivation for doing this course, or why you're interested in learning more about palliative care. And we'll share some of those later on in today's session. So we have most of our participants are from Bangladesh, but I noticed we also have a couple of doctors and nurses who are joining from other countries today as well for this course. So we have, I think, someone from Pakistan, South Sudan, and some from Nigeria, and I know a couple of other countries too. And you're very, very welcome. I will just share with you that the course is designed for Bangladesh. So you'll find some parts of the course are translated and it's short periods into Bengali, but most of the faculty don't speak Bengali either. So I think you'll get just as much out of the course as those joining from Bangladesh. So welcome, a big welcome to everybody. So I'll start by introducing myself first. And my name is Catherine. I'm a palliative care specialist from the UK. I was working as a medical doctor with MSF 12 years ago now in Kutupalong camp in Bangladesh in the Cox's Bazar region. And I continue to work with MSF, but now in palliative care. More recently, I was working in Jordan in the Middle East. And I will be co-leading and I'll be on the faculty for this course, and I'll be co-leading and coordinating the course with Dr. Megan. So I'll just call on the rest of the faculty to introduce themselves one by one. So Dr. Megan, do you want to go next?
শুভ সকাল আমার নাম Dr. Megan আমি একজন doctor. That's about all the Bangla I speak, but আমি 3 বছর বাংলাদেশে গিয়েছিলাম. So 3 years I spent in Dhaka, and I'm a palliative care specialist in pediatric palliative care, but I also do adults. And I'm very pleased to be with you. This is our 3rd batch of the course, and I'll be helping Catherine and all of the other faculty to run the course. And please don't hesitate if you have any questions, any concerns, message Saeed, who's our program coordinator and course director within Bangladesh, and he can help you out. And don't be shy. Okay, and you can write messages on the WhatsApp group and we'll be trying to help you answer them. And if you feel a little bit shy in English, just write your message in Bangla. We have Bangla faculty, and Saeed, of course, speaks Bangla too, so we will all help you in Bangla or in English. So welcome, everyone.
Thank you, Megan. Hunter, can you introduce yourself next?
Sure, can you hear me?
Yes.
Okay. Hello, I'm Hunter Groninger. I'm a doctor, a palliative medicine doctor in the United States in Washington, D.C. at Washington Hospital Center. And I felt very lucky to be able to visit Cox's Bazar in January of 2020, right before the pandemic started. And so have a sense about the region and did some teaching there. And this is also my 3rd experience teaching in the ECHO project. So very happy to be here. Thank you.
Thank you, Hunter. Anne, can you introduce yourself next, please?
Hi, everyone. I'm Anne Kellerman. I'm a palliative care social worker, also in Washington, D.C. And I'm very happy to be here today. Thank you.
Thank you, Anne. Layla?
Hello, I am Lailatul Firdaus from Dhaka, Bangladesh. I am a palliative care nurse and working in Department of Palliative Medicine. And I am happy to share my experience and knowledge to you. And I am a nurse faculty in this course. And I would be happy if you need any clarification in Bangla, please let me know. Thank you.
Thank you, Layla. Tasnim? We might have lost Tasnim for a moment. Dr. Vinky, can you introduce yourself, please?
I think she's there. She just was muted.
Can you hear me now?
We can hear you now. Thank you, Tasnim. Go ahead.
Assalamu alaikum. আমি ডক্টর তাসনিম, আমি একজন বাংলাদেশি মেডিকেল ডক্টর। IOM এর সাথে কাজ করেছি 1 year পর্যন্ত প্রোগ্রাম ম্যানেজার হিসেবে কক্সবাজারে প্যালিয়েটিভ কেয়ার প্রোগ্রামে। আমি এখানে ফ্যাকাল্টি হিসেবে কাজ করছি। আমার মূল কাজ হবে বাংলায় আপনাদেরকে কানেক্ট করা। Hi, this is Tasnim. I worked as a program manager with IOM in Cox's Bazar Rohingya refugee settings for palliative care program, and now one of the faculty member with this ECHO program. And I hope all of you will enjoy it. Thank you.
Thank you, Tasnim. Dr. Vinky, can you introduce yourself? Can you just check if you're muted? Sorry, go ahead.
I'm working as a medical officer in Insurance Rescue Committee, and I have done 2 palliative care training, and I'm just new as a faculty member, and I hope you will enjoy this training session. Welcome you all. Thank you.
Thank you. Roshan?
Yeah. Assalamu alaikum. I'm Rajhara, palliative care nurse from Bangladesh. Welcome to you all. Thank you.
Thank you, Roshan. And Anna?
Hi, everybody. My name is Anna Work, and I'm a palliative care physician based in Canada. And I had an opportunity to go to Cox's Bazar in 2019 August to do some teaching there. And then I also was supporting the COVID response with palliative care when I was seconded to IOM in last year. So welcome, everybody.
Thank you, Anna. And I've been scrolling through the list, and I think that's all the faculty we have today. Is there anyone on the faculty that's here today and they haven't introduced themselves? I think we have everybody. We do have additional faculty members, and what we'll ask them to introduce themselves as they join the next session and moving forward, so you get to know who the faculty are. So I'll just explain a bit more about the course structure. So we will have, this is the first of 11 weeks of palliative care training, and there will be 7 sessions which are considered core sessions, which are compulsory to complete to get the certificate at the end of the course. In addition to these 7 sessions, we will have 4 sessions which are what we call sort of open or mentoring sessions, and these are sessions that we strongly encourage you to come to because it gives you additional knowledge, but we also open these sessions to previous participants who have done the first and second course, or anybody else who wants to join from Bangladesh as a main target area, really. So these will be the in between the core sessions of the course. For the core sessions of the course, we will share with you pre-recorded videos. So this will be on the topic for the week. So the topic that's being taught that week. We will give you some videos, a link to the YouTube where you can watch some videos in advance. And we really ask you to do this because the information is mostly going to be in the pre-recorded videos. And we ask you to watch those and then bring to the session, which is always going to be on a Friday evening at the same time, 8:30, any questions or comments you have from the video, so we can discuss more about the detail in the video together as a group. So each week for the core sessions, we will have then the same speaker from the video will give a live summary of the key information. I'm not sure if someone had a question there, but please do, I will answer any questions in a moment if that's okay. I'll just finish this part of the explanation. So we will ask you to, that we will have a summary of the key learning points, the key information live in the teaching session. And we'll have then the chance for discussion and for any questions that you have after that summary session. And then each week, one of the faculty members will present a case. And this case will really be to sort of put into context the learning and make it come alive. So it will have a real case of patients that we've cared for in the past to illustrate some of the learning that we've had for that session. So that's how the core sessions for this course will run. The additional sessions will be slightly different. In general, they'll be without a case presentation and there'll be longer teaching sessions. Some of them will have pre-recorded videos and some will not. Now, don't worry too much to remember all of that information because we will be sharing all the information on the WhatsApp group. So if anybody hasn't yet joined the WhatsApp group, please do join because we'll use that to remind you about the sessions, to share any videos for the sessions that we want you to watch ahead of the sessions, but also we'll share the recording of the sessions. So make sure you have join the WhatsApp group, and it's the batch 3 WhatsApp group that's going to be key for this course. So, so we'll keep communicating with you. We'll give you updates so you know what's coming up for the next week. Now, the aim of this course is really to improve your knowledge, your attitude, and your skills in basic palliative care. And while we hope you get some very good information that can change your practice, it's really the start of palliative care learning. So what we'll also aim to do is to signpost you to future courses and future opportunities to continue your learning in palliative care during and beyond this course. So this is sort of a start of your learning in palliative care. That's the idea of this course. Now, we know it can be difficult to attend all of the courses. The nature of the work we do means that sometimes we'll be on call and we'll be on duty during these sessions. So that's no problem. Please do attend if you can. If you can't, please do make sure you watch the recording of the session. And this will usually be shared within a couple of days of the Friday session. So watch the recording and let us know that you've done that so that we can mark you as attended, so that we can know you've completed the course and we can give you a certificate at the end of the course. Okay, so that's most of the outline of the course. Just to tell you a little bit about using Zoom. For some of you, it might be the first time that you're having teaching over Zoom. So as Dr. Megan said earlier, please do use the chat, and I can see the chat's being active as I'm speaking, which is great. So please do use the chat to put any comments or questions in at any time during the webinar. And as Megan said, this can be in English or Bangla. And we'll be monitoring the chat and sharing all the bits in the chat that are relevant to the group. We'll bring for sharing as well. When you're, as Megan also said, please do mute yourself unless you're speaking. And if you're having connection problems, just keep your video off. It will improve your signal. Tasnim, can I hand over to you to give a quick translation of what I've just shared?
Sure, please. আমাদের এই কোর্সটি আমরা 7টা ক্লাস করাবো সর্বমোট, এবং 7টার ভেতর আপনাদেরকে 4টা ক্লাসে উপস্থিত থাকতে হবে। 4টা ক্লাসে উপস্থিত থাকলেই আপনারা কোর্সের সার্টিফিকেট পাবেন। আমরা ধাপে ধাপে আপনাদেরকে জানাবো যে কোন দিন আমরা কোন টপিক নিয়ে কথা বলবো, এবং ক্লাস শুরুর পূর্বে আমরা আপনাদেরকে একটি ভিডিও লিংক শেয়ার করব। সেই ভিডিওটি আপনারা দেখবেন, দেখার পর আপনারা পরবর্তীতে ক্লাসে আমরা এই ভিডিওর সামারি নিয়ে কথা বলবো, এবং সেখান থেকে কি লার্নিং পয়েন্টস কি ছিল সেগুলো নিয়েও আমাদের আলোচনা হবে, এবং আপনাদের মনে যদি কোনো প্রশ্ন এসে থাকে সেটা নিয়েও আলোচনা করা হবে। এছাড়াও আমরা একটি করে কেস নিয়ে আলোচনা করব। কেসগুলো বেশিরভাগ ক্ষেত্রেই হবে আমরা যেই কনটেক্সটে কাজ করি সেই কনটেক্সটের সাথে রিলেটেড। আর এখনই সবকিছু মনে করার কিছু নেই, কারণ আমরা আপনাদেরকে পরবর্তীতে সবকিছুই জানাবো কিভাবে হচ্ছে। আমাদের ক্লাস হবে প্রতি শুক্রবার এই একই সময়ে। কেউ যদি কখনো কোনো ক্লাস মিস করেন সেক্ষেত্রে
We've lost your sound, Tasnim.
Yeah, I think I was muted. আপনারা কোথা থেকে আমাকে হারিয়েছেন আমি জানি না।
একটু ইন্টারফেয়ার করছি একটু। এই যে বিবো 1935 ইনি কে? ওনাকে বারবার আনমিউট করছি, উনি মিউট থেকে আনমিউট করছে। কথা বলবেন বিবো, আপনি একটু আপনার নামটা চেঞ্জ করে নেবেন, তাতে করে আমাদের একটু সুবিধা হবে, আপনাকে একটু ট্রেস করতে সুবিধা হবে। একটু বলবেন আপনি কে? বিবো 1935, একটু কথা বলবেন আমাদের সাথে। Well, please go ahead.
Thanks, Said. আমরা প্রতি শুক্রবার ক্লাস করব এই একই সময়ে। কেউ যদি কোনো ক্লাস মিস করে যান, সেক্ষেত্রে আপনাদের ক্লাসটি করার জন্য আবার সুযোগ থাকছে। আমরা একটা ইউটিউব লিংক শেয়ার করব, আপনি সেটি করে নিতে পারবেন। আর আমরা মনে করছি এটা হচ্ছে শুরু প্যালিয়েটিভ কেয়ার সম্পর্কে জানার জন্য, এবং আমরা পরবর্তীতে কোনো আপডেটেড ইনফরমেশন যা কিছুই পাবো সেটা এই নেটওয়ার্কের মাধ্যমে আপনাদের সাথে আমরা শেয়ার করব। আর আরেকটা অনুরোধ থাকবে, যখন কথা বলছেন না তখন মাইকটাকে মিউট করে রাখেন। আপনাদের কারো কারো ডিভাইসের নামে এন্ট্রি করা, রিনেম করে নেন, রিনেম করে আপনার নামটি সেখানটায় দিয়ে দিন। ধন্যবাদ। থ্যাঙ্কস, ক্যাথরিন।
Thank you, Tasnim. So I'm just going to share a couple of the comments in the chat box before we start with the presentations for today. So update my knowledge and develop my palliative care knowledge and skills. And this is from Dr. Lutful. Thank you, Dr. Lutful, for this. I'm not going to be able to read all of them out, but I'll just read a few. I think from Parmita, I think this palliative care echo session will help me to know details about palliative care. And you're working with IOM at the moment. Super, thank you, Parmita. And I hope I say your name correctly. Kondakar, you've shared that you have a personal and professional interest in palliative care. So you're most welcome. And I'll just see. So more people joining from the IOM team. So you're all very welcome. And you have this is from Dr. Murdle. I got basic training from palliative unit in our IOM, and you hope for the best. You want to join and hope for the best. That's super. Thank you for joining us. I hope for the best too, and I think the best will be to go away with some great knowledge and skills in palliative care, and that's what we hope you will all have. And Samul Islam, to increase my knowledge about palliative care. Super. Let me just, and Dr. Ashrafur, I think this course will increase my knowledge, confidence, attitudes in patients management. And you're working in an NCD program in Camp 8. Welcome. That's super. So thank you very much. We'll keep reading we'll keep having a look through these postings that everyone's done, but thank you all for being so active and sharing your motivation for the course. And I'll just read one more out before we start from Tariful, Dr. Tariful Islam. I've decided to enroll in this course to enrich my knowledge and skills, which will ultimately help me to serve more efficiently in humanitarian crisis situation. That's super. So welcome to everybody, and thanks for sharing. And so now I'll hand over to Dr. Megan. So Megan is a pediatric palliative care specialist in Canada, as she shared with you earlier. Megan has been responsible for setting up this course and leading and coordinating this course from the very start. So I'll hand over to Dr. Megan, who will tell you a bit more about an introduction to palliative care and how it can help patients. Thank you, Megan.
Thank you, Catherine. So I just want to, can you still hear me okay?
We can hear you.
Okay. My computer is maybe a bit fragile today. I just want to say thank you to everyone, and especially I just want to highlight our partners. So Fasidin Khan Research Foundation, Bangladeshi foundation that's involved very much with palliative care delivery in various parts of Bangladesh. Pal Chase, who is Palliative Care in Humanitarian Aid Situations and Emergencies. It's an NGO basically, and Two Worlds Cancer Collaboration Foundation, which is a Canadian NGO, which is supporting us in terms of giving us the Zoom license and a few other supports in the background. And this is called ECHO. ECHO India is also an organization helping us run this training program with the format and the structure that they have. So we're all working together, joining up with you from various places. I want to tell you a little story from 2017 when I first came to the Rohingya camps, when all of our dear patients and their families had to come very suddenly to Bangladesh from Myanmar, from Rakhine State. So this is one of the first patients that we ever saw in the Rohingya camps, Mujibur, and he was a little boy with a cancer in his leg called an osteosarcoma. And when he first was diagnosed at a hospital, outside the camps, his mother was just so sad because there was nothing that the camp doctors said that they could do to help him. And so she took him back to the tent and she just felt so overwhelmed, not knowing how she could help him. He had been so healthy before, and now he was having terrible pain. And then he was picked up by one of the palliative care programs, the very first program in the camps, which was run by Dr. Farzana Khan with the Fasiduddin Khan Research Foundation. And they were able to give him good pain medicine. They were able to give him some morphine, which is safe and effective when it's used properly for children. And then he was feeling so much better. So this is a little video of him at the beginning when he was first joining the program and he didn't feel very good. And then I'll show you a video after. Oh, I don't think I'm going to be able to show you the videos, unfortunately. My computer is not feeling it can do that today. So let's see if I can get the next slide. So I want to emphasize about palliative care. One thing about palliative care is it's an essential part of the care that we provide for our patients. It's not something extra, something fancy. It's part of universal health coverage, and we need to focus on relieving and preventing suffering in patients with incurable diseases. And that falls under Sustainable Development Goal number 3, which is good health and well-being for all. And we know that even in humanitarian situations like what we're facing in the Rohingya refugee crisis, palliative care is very important. We know that in humanitarian crises, there's a lot of loss of life. There's a lot of suffering, physical, psychological, social, and spiritual. And we've seen this in the people who have come from Myanmar, that there's been a lot of suffering. You know that many of them have PTSD and they have a lot of trauma, and it's very challenging, and palliative care can help. There are many situations where we can't cure our patients. Many of the diseases that they have, be they from the host population or from those who've come from Myanmar, are going to be things we cannot cure. So we have to think about how we can provide care that isn't aimed at cure, but is aimed at reducing suffering and improving quality of life. And here are some of the patients that we sometimes think about. These are just some examples. A frail elderly person, that person could really benefit from palliative care. In some humanitarian crises like the Ebola crisis, COVID crisis now, there might be patients who really need palliative care. And then we often see very small and premature babies, and we cannot often provide them with the care that would allow them to survive, but we can support them anyways. So what is palliative care? Many people think that palliative care is when somebody is just having days or weeks left to live, when they're dying. But we know that palliative care can be provided from the time of diagnosis with a life-limiting or life-threatening condition, and it can go over many months or even years. It does not hasten death. We are not making the patients die sooner. It has nothing to do with that. It is about improving quality of life for patients facing serious or life-threatening illnesses and thinking about their whole family's needs, because we know that the illness doesn't just touch the patient themselves. It has a huge impact on the whole family. So we say it's about living well. And the good thing that has happened over the past couple of years is that in the policies of humanitarian aid, which is specifically the SPHERE project, which tells us how we deliver essential healthcare in humanitarian crisis situations, palliative care has been incorporated into the SPHERE standards. So you can see here an image of what does the health standards for SPHERE look like. And there's these components of essential healthcare: communicable diseases, child health, sexual and reproductive health, etc. And one of them is palliative care now. So we need to follow these standards. You need to help your organizations integrate these standards into their health programming. But there are so many barriers for us. It's so challenging to deliver palliative care in humanitarian situations. And this is a picture that shows some of the major barriers that have been identified to implementing palliative care in humanitarian settings. And you can see there's so many barriers. You know, there's like 10 or 12 on this slide. So how are we going to overcome all of those? Well, one of the important ways is to give training to healthcare providers like yourselves so that we can help to work on these barriers. And so over the next 11 weeks of our course, we're going to teach you about how to manage some of these barriers, how to overcome them, and how to work with them. And we have to recognize that humanitarian healthcare can be focused on saving lives, but it can also be focused on relieving suffering. And we don't have to trade one of these aims for the other. We can have them both happen at the same time. Good care that saves some people's lives can also be developed in a way that incorporates good care that relieves suffering for people whose diseases cannot be cured. And if we think about Sustainable Development Goal number 1, which is to end poverty in all its forms everywhere, then palliative care is also part of this, because we know that the health expenditure and the experience of being very ill leads people to be more impoverished, to spend their money, to not be able to work. So palliative care can be very effective as a poverty reducing strategy. And it's very much person-centered care. This is a picture of one of my colleagues in India who you might get to meet someday, Dr. Raj Gopal, and just the idea of connecting with the individual patient, caring for them, and allowing them to get strength and support from us as healthcare professionals. I want to give you one slide just showing a little bit what's happening all over Bangladesh for palliative care. Now, this is a little bit old. It's from a few years, maybe 5 years ago, when The Economist looked at what is palliative care like in Bangladesh, comparing it to what is palliative care like in other countries around the world. And palliative care at that time was very centralized, and most of it, if any was happening, was in Dhaka. And there was some limitations. You can see here, they gave a score out of 100 for each of these 5 elements of palliative care. So the green is the highest score, which was given to the UK, I believe. The red is the average score, and the blue scores were the scores that Bangladesh got. So very small scores for human resources, palliative care and healthcare environment, community engagement a little bit higher, and affordability of care a little bit higher. So just to say that we know that there's a lot of challenges, both in the humanitarian sector and also in the healthcare sector of Bangladesh itself, in terms of delivering healthcare and delivering palliative care. But actually things have come a long way in the past 5 years since this study was done. We have many more nurses and doctors working in palliative care. We have Department of Palliative Care at Bangabandhu Sheikh Mujib Medical University. We have other community providers in Bangladesh who are doing big palliative care projects. In Naranganj, there's been a project to deliver palliative care for the whole city. In slums like Kora Slum in Dhaka, we've had palliative care being there for now 5 years. And so it is coming, and this is a big step forward for you guys to join this training and help us to see more palliative care in the Cox's Bazar region, both for the displaced population, but also for the host population. And last year in the IOM project, many host population members were also cared for by the palliative care project. So in summary, palliative care is holistic care. It's for all of the patients who have life-threatening or life-limiting or serious illnesses. It's for all the age groups, and it can be given with treatment that includes rehabilitation and optimization of function. It doesn't have to exclude treatments that might cure the patient or that will help them. We can combine these treatments together and give patients the best possible quality of life. Thank you very much.
Thank you, Megan. That was very clear and informative. And I just want to say we will have time for questions and discussions, but we're going to do that after our second speaker, Tasnim. And also just to say, these sessions are all recorded. So if you want to go back and look at any of the detail from Megan's slide or the references later, and also those we are recording this session, so a very big welcome to all of you who have joined partway through, and you'll have access to recording, so you'll be able to to catch up on the part you missed. So we'll have some discussion time later, but first I want to introduce our second speaker. It is Dr. Tasnim, who was involved in setting up community palliative care service within the camps for Rohingya refugees in Bangladesh. So a very knowledgeable speaker, and she'll be also speaking next week on community palliative care. There's a little pitch for her. So I introduce and hand over to Dr. Tasnim.
Thanks, Dr. Catherine. Thanks, Dr. Catherine. Said, will you share? Said, can you hear me?
Yeah, I can hear you. Would you like to share or I should share?
Please share from your end. Thank you. Okay. Welcome once again. Assalamu alaikum. My name is Tasnim bint Azad. I'm a Bangladeshi medical doctor. We already have an introduction, and I will talk about palliative care in Cox's Bazar, Bangladesh. I worked as a program manager with the only palliative care program exists in Cox's Bazar in the Rohingya refugee camp. Next, please. In Rohingya camp or any other refugee settings, we used to talk about human rights or the fundamental human rights, refugee convention, something like this. And I just want to address your attention that health is a fundamental human rights for all. It doesn't define whether you come from a host community or from any other community. This is the right for all, and you can see it's written here in 1951, the Refugee Convention. It's also said the same thing, that it should be same. It should be same or similar healthcare for host population and also for the refugees. Next one, please. I just quoted some WHO key facts regarding palliative care, and the estimation you could see, the 40 million people are in need of palliative care, and among that 40 million people, 78% of them are living in low and middle income countries. And worldwide, only 14% of people, those who are in need of palliative care, is currently receive it. So a bigger percentage are not receiving it at all. And we could say the adequate national policy program, resources, training, which one you are attending right now, for the healthcare professionals are in bigger need to improve the access of palliative care. As I said, many of them are not receiving it, and the reason behind it could be we don't have enough policies, programs, resources, and trainings. And palliative care will continue to grow as a result of aging of population, as the people are getting old, and you know, the non-communicable disease burdens and some communicable diseases also. So that's how we can look at the key facts of WHO. Next slide, please. From WHO key facts, let's look at palliative care in Bangladesh. Why we need this in Bangladesh? You can see near about 600,000 patients in Bangladesh who need palliative care each year. And among them, 200,000 patients are actually diagnosed with cancer annually. And the data is taken from a slide where it was showing that 80 to 90% of cancer patients are incurable at the time of diagnosis. It means when we receive the patient, they are already in an incurable stage. Next, please. With the help of Fasudin Khan Research Foundation and two World Cancer and Pelches, we did some initial palliative care works inside the Rohingya camp. It was right after the influx. And we did one need assessment survey in November 2017. And there was a small home-based palliative care activities. It was led by Dr. Farzana Khan, who is a national palliative care consultant and CEO of Fasudin Khan Research Foundation, herself with two Rohingya community volunteers. They visited more than 1,000 patients. And later that in February 2020, IOM took over the program and expanded these palliative care activities. Next, please. Just a brief background about Fasudin Khan Research Foundation. It's a Bangladeshi organization. This is the very first organization who started providing palliative care for this forgotten population with life-threatening and life-limiting illness in humanitarian crisis. Next, please. Whenever we ask that what was, or I get question from people that what were the challenges when you started, the very first thing that I used to speak still now, the healthcare professionals understand, they used to ask me that why palliative care is needed in this field. And in-person training in camp during COVID was also a bigger challenge because, you know, due to COVID, we were maintaining physical distancing. And I would like to say about morphine, I can assess from my previous experience in Rohingya camp, whether we should prescribe morphine or whether we can use morphine in the Rohingya camp. There were a lot of controversial issues among the healthcare professionals. I hope we will address this in this course, that what is the current stage to use morphine and how a patient could be benefited from this use. So we will try to clear all these confusions. And another challenge was not to integrate this palliative care, just to see it as a different part and sending all the patients and referrals to a particular team, that someone is working with palliative care, so it should directly go to that team. But in reality, we cannot. Yeah, I could say many of my colleagues are present here, those who are working in IOM palliative care. So just to address this is a kind of integration, not to take it in anyone's shoulder. And while I started, I got questions and comments from our colleagues that we will not get patient inside the Rohingya camp to provide palliative care. Next slide, please. Just now I said that I got comments that we will not receive palliative care patient inside the Rohingya camp because that doesn't exist. I'm showing here that within 9 months of period, we received 6,000 patients inside the Rohingya camp. Among them, 1,000 patients were actually from the host community. I know many of you have very brief idea that how the host community and the Rohingya community is separated in the camp in Ukhia and Teknaf. It's like many of the patients from host community from Cox's Bazar and Ukhia region traveled to the camp to see the palliative care team, and from their side it was we heard that one team is working inside the Rohingya camp for non-curable diseases. So that's how we came here to visit. Next one, please. And while we started, it was a big question that how will you identify or refer the palliative care patient to this program? We tried to communicate with the clinic in charge and the triage nurse. And that's how, while they are getting any patient inside in their triage station, they used to send the patient to our to the palliative care corner. And people like you, those who attended palliative care trainings before, both in person and virtual trainings, they used to call us, direct call, or sometime before sending the patient, they used to check with us whether we are available in that certain facility. And another good initiative regarding community palliative care is the palliative care assistants, who are non-clinical part of palliative care team. They used to visit the community door to door and informing all the individuals that if there is anyone having serious illness, still there is something that we could do from our team. Next, please. Works have been done. You can see our echo slides here that our team members attended palliative care trainings. And while we started, a national palliative care consultant was leading this palliative care program. So it was good to get clinical guidance from her side. And during COVID, we ran many virtual classes with different palliative care topics. And we are still connected on WhatsApp. And I thank other palliative care physicians across the globe that whenever I asked any question about a particular patient, I got answer in that WhatsApp group. Next, please. This is a question: who can provide palliative care? Is it our duty to provide palliative care, or it should go directly to a team? We will discuss about this later. Just to summarize this slide, palliative care could be given in any settings: home, community, hospital, and now you have ITCs inside Rohingya camp. That's also can provide palliative care. The baseline is palliative care approach, which is all of us. And the middle line could be the general palliative care, the specific team who works there for palliative care. And specialized palliative care, you can see, is narrow. So not all of our patients need specialized palliative care. Still, the baseline could be provided by all of you. Next, please. My colleague, Dr. Megan, already described about the sphere standard and palliative care is essential healthcare. Still, I keep this slide because during COVID period, I got call from my organization to stop this activity, I mean the palliative care activities, because they are looking at essential healthcare. And this is the slide that helped me to make them understand that palliative care itself is an essential healthcare. So by any means, inside the humanitarian context, we can't stop it. Next, please. We took many initiatives while we started because we had very little idea how this will go on. And the very first one, you could see capacity building training. And we tried community-based approaches rather than the facility-based one, because with certain disease condition, patients are unable to visit our facilities that frequently, and it's a kind of extra burden for family also. So we looked at that one. We got continuous guidance and support from our project lead. And last but not the least, we are very much flexible. I know how flexible Bangladeshi healthcare professionals are, and we try to cope up with different situations to make ourselves stable. Next, please. This is probably the last slide. It was really difficult to look at palliative care in Rohingya camp for almost 90,000 people, and there's 33 different camps actually, with the small team that I started. But the integration with all of you in the health post, PhD level, even having the basic understanding that why we should think about palliative care could be the ultimate goal. And as I worked in palliative care program, it provided me sense of purpose. I know many of you will agree with me. And the last one is saving life and alleviate sufferings. Both are important. Sometimes we are not in a stage to always think about saving life, but if you think about relieve the sufferings, that will be really beneficiary for your people or for your patients. Next. If you have any question, you can write it, or you can unmute yourself and you can ask. Thank you.
Hello, Tasnim Apu. So I have one question. Does you show the pyramid of the palliative care? So those are the from bottom and to top. Can you clear it? I just have confusion regarding this the pyramid that is show in the slide.
Sure. Said, can you please put that triangle slide? Thank you. Dr. Muttaqin, just to clear that one, yes. In this triangle, you could see the palliative care approach. It looks in the bottom part and is wider than the specialized palliative care part. So the palliative care approach means those who are getting even this training, those who are working in different PHCs, those who are not entitled to something like palliative care medical officer or palliative care nurses, they are in this bottom stage. They can still provide palliative care approach. If I'm not wrong, you were involved in palliative care ECHO second batch training, and we tried to focus the idea how it works, how we can implement it better, what will be really, who will be really benefited from these palliative care approaches. That's how this bottom line made. Palliative care approach could be provided by any healthcare professionals. It's not like that anyone, a specialized team should take handover of this project, this task. The middle line is general palliative care. At the moment, I know one team is working inside the Rohingya camp, so we could address them as a general palliative care team. And the top line is the specialized palliative care. You can see it's narrowing. So not all of our patient needs a specialized palliative care. Still, we can do that. I mentioned we do have WhatsApp group. Whenever we get question from your side, and if it's like we can't reach any national palliative care consultant, we used to post it to that WhatsApp group, and we get answer from specialized palliative care doctors. I think Dr. Catherine is here. I knocked her several times with few of my patients. So Catherine, will you please speak up?
Thank you, Tasnim. Thank you for this presentation and sharing your experience. And just to highlight that, the WhatsApp group we will use to share information, but you can also use it to ask for information too. So if you have questions on a clinical, please do use it for that. You can consider it as a community of support, of specialist palliative care support. And just to say that Dr. Tasnim will be sharing more in the next session about community palliative care, setting up community palliative care within the camps for Rohingya refugees in Bangladesh, and about how that worked. So you can hear more from Tasnim in next week's session, which will be an open session before the next core module the week after. Thank you, Tasnim, and thank you, Megan, both. I just want to highlight a couple of points that came up in the chat, and please do write your questions. Please do write your questions and comments in the chat box. But we had a question about if palliative care can help for patients beyond cancer diagnosis, and also if it can help for patients with physical disability, including patients who've had an accident. And we will go over a bit more in the next core session about the who can be enrolled in the palliative care program. But Megan, do you want to say a bit more about that live to share with everybody, just to give a fuller answer? I know you've responded already on the chat.
Yeah, I think definitely. And I think it's what Tasnim said. For some of the patients, you just need a palliative care approach, right? You need to think about the patient in a way that doesn't just think about the fact that you cannot solve their underlying disease, right? You can't fix somebody who has paralysis. You can't unparalyze them. So you need to think, okay, for this person to live their best life, what do they need? Okay, do they need a toilet chair? Do they need a commode? Do they need someone to give them medicine to help them stretch? You know, so it's about modifying their life. That's a palliative care approach, okay? Instead of just saying, you know what, I can't help you, right? So I think our emphasis during the course is thinking about how can you help people even when you can't fix their cancer, when you can't fix their paralysis, when you can't fix the fact that they've had a stroke. You always can do other things to help them. And even the example that Tasnim said of the PCAs who are CHWs, they don't know anything about medicine. They can still help the patients, right? Because the thing that patients remember is that we talked nicely to them. We showed them that we cared, even if we couldn't change a lot about their illness. That visit, that connection that they have to us is what really sustains them. And we know that our patients would know the PCAs were coming, they would take a bath the day before, they would get dressed a little nicer, and they wait for you to come. If you come and visit them, it's like it's a very special and meaningful experience for them. So just know that your visit is powerful and you really can help people just through those small things sometimes. And of course, we're going to teach you about the medical management as well. It's not just about sitting with the patient and talking to them. It's also about managing their symptoms. As doctors and nurses and physician assistants and paramedics, you're going to be able to also prescribe medicines that will help the patients feel better.
Thank you, Megan. Thanks for that. And I just want at this point, please do write any questions or do share any comments. But I just want at this point to ask any of the faculty from the old course if they want to make any comments. And sorry, before I do so, Tasnim, I see you have your hand up. Do you want to say something?
Yes, please, Megan, Catherine. I do have a question to Dr. Megan.
Yeah, go ahead.
Yeah, Megan, I saw your slides. You wrote no poverty. No poverty related to palliative care. The place where I born and brought up, we have an idea that if something is having some incurable disease, we used to expense all our savings, even selling lands and other doing almost all we can do for that. And now I work in palliative care. I have very basic idea about how it's related, but will you please explain that how it's related, the no poverty and palliative care? What does it mean?
Definitely. So we know that if patients receive palliative care, then they spend the money better that they have in terms of the treatments that they spend their money on. And we counsel the patient, you know, if a patient has advanced cancer, meaning when I say advanced, I mean the cancer is incurable, okay? And most of the patients who are coming to you, 80 to 90% who present to you who have cancer are incurable, okay? So in that situation, the best thing is not to tell the patient to go to Chittagong Medical College to seek treatment from an oncologist. What's the oncologist going to say? They're going to say, here's some medicine, take this medicine. All of that is just spending money, but it doesn't give the patient better quality of life or living longer. So what we can do is flip that with palliative care and say, you know what? I have bad news. This isn't going to get better, and we shouldn't do a whole bunch of medicine that's very expensive and traveling all the way to Chittagong or Cox's Bazar. What we should do is focus on what's important, spending time together as a family, making sure you don't have pain. And so we can save the patient from spending so much that is futile, essentially spending. So that's how we reduce their expenditure, and we help guide them in terms of better ways to spend the time and energy they have. Does that clarify the point?
Thank you, Megan. Yeah, I think that for me, that was certainly very clear, but I also want to hear from the participants to see if that resonates with you. Have you seen patients that have had that experience? Have you, as an organization, been referring patients for treatment? Because it's not a criticism, it's actually what often and normally, if you want to say, will happen. So please do share any experiences you have if that resonates with you, what Dr. Megan just shared about patients' experience with advanced cancer or other advanced diseases. So do please write in the chat box, or feel free to pop your hand up and speak to the group. I just want to call on Layla, if you want to make any comment while we're allowing the participants to share their comments too. Although we've something now, just hold on a moment in the chat box. So Ashrafa has said, for the moment, any data is available. How many people need or under in palliative care in the camp context? Okay, that's a good question. And actually, Megan has shared, there was a needs assessment done in 2017 by Dr. Megan and Dr. Fazana Khan. And this was prior to the community palliative care service that Dr. Tasnim has just explained a little about to you. This was done in advance of setting up the community palliative care in the camps. So I refer you to that survey to get some more information about that. I believe Megan's put the link in the chat. So please do have a look at that, and that will hopefully answer that question more fully for you. And Tasnim has added here, is it harsh to think about money and property while a family person is suffering from advanced cancer? And this is really the point that that was just being made, is that, you know, for a loved one, there's no value. So family feel free to put everything they have and even what they don't have to do anything that they hope will make a difference. And the point is, when there is no medical treatment that can make a difference, when we have non-curative illnesses, that's when it's our duty actually to protect families from getting themselves into worsening debt when there's no treatment to help. And Erin has a comment here as well. So I think in many cultures, it is human nature to not want to accept news of a family member having an incurable disease. So even as healthcare workers, we have a hard time sharing this news and believing it's so. We sometimes recommend seeking further treatments when it is not possible. This also can further push families into poverty. We teach how to communicate well in these situations that are very hard in palliative care. Yeah, absolutely. So, and Tasnim said, we will have a session on communication skills to help you do those, because these are not easy conversations to have. We know that. And we will give you some skills and some tools to help you have these conversations with patients and their families. Please do keep writing in the chat box. Layla, do you want to add any comments? So Layla's been on the faculty for the last 2 courses. So I just invite you to add any comments, Layla, about the sessions you've heard today or any of the discussion.
Thank you, Catherine. I just want to translate some of the talk from Dr. Megan and Tasnim as well. আমি একটু বাংলায় বলতে চাই যে এতক্ষণ আসলে আলোচনা হচ্ছিল যে প্যালিয়েটিভ কেয়ারে যে আমরা রোগীদের যে অনেক খরচ হয়ে যায় অনেক দামি দামি কিছু ওষুধ কেনার মাধ্যমে, এবং তার পরবর্তীতে দেখা যায় যে কি হয় যে ওই মেডিসিনটা দিয়ে যদি ওনার কোনো কাজেই না লাগে, ওনার রোগটা যদি ভালো না হয়, অনর্থক কিন্তু ওনার ওই টাকা পয়সাটা খরচ হয়ে যাচ্ছে, এবং কি ওনার ফ্যামিলিতে উনি একদম নিঃস্ব হয়ে যাচ্ছে, পরিবারটা আস্তে আস্তে একটা হচ্ছে পোভার্টির দিকে চলে যাচ্ছে। এই বিষয়টা নিয়ে আসলে আলোচনা হচ্ছিল, এবং কি এটা ছেলে মেয়ের পড়াশোনার পেছনে যদি আসলে খরচ করা হয় তাহলে দেখা যায় যে অনেক ভালো একটা এফেক্টিভ একটা সেবা হবে। তো সেই ক্ষেত্রে আমাদের প্যালিয়েটিভ কেয়ারের সাপোর্টার হিসেবে কিংবা কেয়ার গিভার হিসেবে এই জিনিসটা আমরা মাথায় রাখতে পারি। আর কমিউনিটি প্যালিয়েটিভ কেয়ার সম্পর্কে ডক্টর মেগান একটা কথা বললেন যে CWH যারা কমিউনিটি হেলথ ওয়ার্কার, আমরা PCA বলে থাকি, তো তারা কিন্তু আসলে ওই যে আমরা যে পিরামিডটা দেখলাম নিচে যে কমিউনিটি হেলথ কেয়ার প্রোভাইড করা হচ্ছে, সেখানে কিন্তু ওরা খুব ভালো একটা রোল ফিল আপ করতে পারে। যেহেতু আমাদের বড় একটা পোর্শনই হচ্ছে কমিউনিটিতে, আমরা আসলে যদি কেন্দ্রীভূত করে রাখি আমাদের সেবাটাকে, তাহলে কিন্তু খুব বেশি মানুষজন আসলে সেবাটা পায় না। যেমন আমাদের ডিপার্টমেন্ট অফ প্যালিয়েটিভ মেডিসিনে অল্প কিছু মানুষ ইনডোরে আউটডোরে সেবা পায়, মরফিনটাও অ্যাভেলেবেল নাই সব জায়গায়। এই জন্য আসলে যদি কমিউনিটি পর্যায়ে এটা ছড়িয়ে দেওয়া যায় তাহলে আসলে প্যালিয়েটিভ কেয়ারটা খুব দ্রুত ছড়িয়ে যাবে আর কি। থ্যাংক ইউ, ক্যাথরিন।
Thank you, Layla. I just want to share the last comments in the chat. And Rachel, I'm just going to ask you actually to unmute yourself and tell us more. So Rachel is working with MSF in Goyalmara Hospital, and she shared that it can be very difficult to confirm a diagnosis with limited diagnostic tools, which we know is the situation in all of the most of the healthcare centres serving the patients living in the camps. Rachel, do you want to say any more about that?
Sure, I can add a little bit more. I mean, I do think in most cases, if we do a really careful assessment and, consult with telemedicine or other experts, we can often be quite confident in our diagnosis that something is incurable. But there are cases I find where we're not 100% sure. And so that uncertainty makes it challenging to decide sort of what the care should be. But I do think for us, one thing that we've been trying to emphasize is that, as you were saying earlier, you can provide palliative care even though you don't know for sure if like you can continue the other treatments to try to extend the child's life. I think the challenge is when we're making decisions about referrals for children, sometimes to other facilities, that can be difficult.
Thank you, Rachel. Thanks for sharing. And I think, as Megan put a comment in about, we can even provide palliative care even when we're not sure. So we hope what we'll do during this course is to teach you an approach to caring for children, for adults that have palliative care needs, or even when there's uncertain diagnosis. We want to teach you a packet of tools and a way of approaching these children, these adults, that addresses suffering in terms of physical and psychological symptoms, that addresses how to better communicate with these patients and families. And sometimes communicating uncertainty is what we have to do. And there is a lot of uncertainty often, certainly around prognosis. So we'll teach you on how you can communicate, and including when it's not fully clear. And it's okay to be uncertain, and it's okay not to know. We don't have all the answers sometimes. And things like care planning. So we can give you some skills and some tools that you can use to, even if it's unclear the diagnosis, how you can approach these children, how you can do your best with the information that you have. Yeah, so we hope to do that during the course. Thank you, Rachel. Any other participants want to share any ideas or comments, or if you have any questions about any of the content you've heard today, or even however simple it might seem, please do ask. There is no question that's too simple. And you might ask the question that everybody else is wanting to ask and just hasn't unmuted. Tasnim, you have your hand up again. Do you want to speak? And we'll watch the chat.
Yes, I would love to.
Thanks.
Both Rachel and Irene asked me that regarding the palliative care or the diagnosis confirmation inside the Rohingya camp. The time I started working, there was a prohibition to send any cancer patient out of the camp for diagnosis or any other thing, especially by CICs, that once it is cancer, you are not allowed to send the patient, because the idea is this is already someone who will die. So the idea, having very least idea, in cancer also there are certain diagnoses in which we can help. That was when I started working. And I can still remember one of my patients with scrotal carcinoma. He was operated, and patient came to me and said that I'm the patient. That was the situation. So, and I can still remember in previous session, we had very interesting conversation with a few doctors who were saying AML is curable. So why don't we send the patient? Why don't we refer the patient? And Dr. Megan gave really good insights on that. I hope we will share this during the classes. Thank you.
Thank you, Tasnim. Thank you. And I just realized that we did not introduce Erin. Thank you for the reminder, Megan. Erin has joined our faculty for this course. Erin, can I ask you to unmute and just give yourself a small introduction for the participants? Thank you.
Hi, everyone. My name is Erin. Thanks a lot for having me here. I'm a palliative care nurse from Canada, and I had the pleasure of about 5 years ago meeting Dr. Megan in Bangladesh, as well as Nurse Laila and Nurse Roshan. We were living in Mymensingh, so we were very happy to be in Bangladesh, and I'm excited to be connected to the program again. I'm currently living in Nairobi, Kenya, and doing palliative care nursing here. So I'm happy to be here and I'm excited.
Thank you, Erin. Thank you. And also, I'm sorry my video's off, but my internet connection's been a bit choppy, so that's why you're not seeing me for this part of the webinar. So I just want to remind everybody about the pre-course survey. It's really helpful if you can fill that in for us, because it allows us to compare your pre-course questions with your post-course questions. And what we can do with that information is we can improve the course for future participants. So it's really useful for us if you can complete that survey. I'm not sure if the link is in the chat, but I'm sure it will be in a moment. I think you've all received it already as part of your registration, but we can post it in the chat. For those of you that haven't completed the survey, please do so. I want to ask Tasnim now to give a summary in Bangla of today's session, if that's okay, Tasnim. And then before we go, we'll just introduce the next couple of sessions. Thank you, Tasnim.
Thanks, Catherine. আমাদের আজকের ইন্ট্রোডাক্টরি ক্লাসে আমরা কথা বলেছি, আমরা দুটো লেকচার শুনেছি। একটা হচ্ছে বৈশ্বিক প্যালিয়েটিভ কেয়ারের অবস্থা কিরকম, এবং আমি যেখানে কাজ করেছি কক্সবাজারে প্যালিয়েটিভ কেয়ারের অবস্থা কিরকম বা আমরা কিভাবে শুরু করেছি সেই সম্পর্কে। আমি জানি আপনারা ডক্টর মেগানের স্লাইডে দেখেছেন যে প্যালিয়েটিভ কেয়ার কেন আমাদের প্রয়োজন এবং বাংলাদেশ কোন অবস্থানে রয়েছে সেটি দেখানো হয়েছে। তারপরও আমি জোর দিব একটি বিষয়ের উপর, যেখানে আমাদের বলা হয়েছে যে প্যালিয়েটিভ কেয়ারে বাংলাদেশের পরিবেশগত অবস্থান অথবা লোকবল কিরকম রয়েছে, আমাদের সামর্থ্য রয়েছে কিনা প্যালিয়েটিভ কেয়ার দেওয়ার জন্য, এবং জীবনযাত্রার মান অথবা গুণগত মান বলতে আমরা যেটা বোঝাই, আমাদের কমিউনিটিকে এঙ্গেজ করার ক্ষেত্রে আমরা যেটা বোঝাই, এইটাতে বাংলাদেশের অবস্থান আপনারা দেখেছেন। ইউকে দেখানো হয়েছে, ইউকের অবস্থান ছিল একটা সবুজ লাইনে, তারপর একটা রেড লাইন ছিল, আমরা ছিলাম ব্লু লাইনের ভেতরে। এই ইন্ট্রোডাক্টরি ক্লাসে এটা দেখানোর উদ্দেশ্য হচ্ছে আমরা আসলে কোথায় আছি সেটা বুঝতে পারা, এবং ট্রেনিং এর কোনো বিকল্প নেই সেই বিষয়টা সম্পর্কেও আমরা জানা, যে আমরা যদি এই ট্রেনিং গুলো করি এবং আমরা আমাদের নিজেদের নলেজটাকে আপগ্রেড করি, তাহলে আমাদের জন্য ধরতে সুবিধা হবে যে প্যালিয়েটিভ কেয়ার কিভাবে আমরা দিতে পারি হিউম্যানিটেরিয়ান সেটিংসে। এছাড়াও আজকে আলোচনা করা হয়েছে আমাদের কবে কখন ক্লাস হবে এবং ক্লাসগুলোর প্রাথমিক পর্যায়ে কি করা হবে। ক্লাসের পূর্বে আপনাকে একটি ভিডিও লিংক শেয়ার করা হবে, যেটি আপনি নিজে দেখবেন এবং আপনার মনে কোনো প্রশ্ন থাকলে সেটি আপনি জিজ্ঞেস করতে পারবেন। কেউ যদি কোনো কারণে ক্লাস না করে থাকেন, সেক্ষেত্রে পরবর্তীতে ক্লাসটি করে নেওয়ার সুযোগ থাকছে। আমি আরেকটু গুরুত্ব দিব, 7টা ক্লাসের ভেতর আপনাকে 4টা ক্লাস অবশ্যই করতে হবে আপনি সার্টিফিকেট পাওয়ার জন্য। আমাদের বাংলা এবং ইংরেজি দু ধরনের ফ্যাকাল্টি মেম্বারই রয়েছেন, সুতরাং কেউ যদি ইংরেজি বলতে না চান অথবা মনে করেন যে আমি বাংলায় বলতে চাচ্ছি অথবা কথা বলতে না চান, শুধুমাত্র চ্যাট বক্সে লিখতে চান, আপনার যেভাবে মনে হয়, এটা একটা জানার জন্য প্ল্যাটফর্ম, আমাদের লার্নিং প্ল্যাটফর্ম। আমরা এখান থেকে শেখার চেষ্টা করব, যেটা আমাদের জন্য নতুন সেটা ভালোভাবে শেখার চেষ্টা করব। এমনকি আমি বলছি না যে শুধুমাত্র আমাদের কথাগুলোই আলোচনা হবে, আপনারা যেই সমস্যাগুলো ফেস করেছেন, আপনাদের যে জিজ্ঞাসাগুলো রয়েছে, এগুলো বাংলা অথবা ইংরেজিতে হয় চ্যাট বক্সে অথবা নিজেকে আনমিউট করে অথবা ব্যক্তিগতভাবে হোয়াটসঅ্যাপে টেক্সট দিয়েও আপনারা জানতে চাইতে পারেন। ধন্যবাদ। থ্যাঙ্কস ক্যাপ্টেন, আই এম ডান।
Thank you, Tasnim. Thank you. And I just want to, before we finish today's session, there was just a question in the chat about how do we communicate to others about the importance of palliative care. And it can be tricky. This is one of the challenges we face in palliative care all over the world, because while most medical specialties look at mortality data, that doesn't work in palliative care. Okay, so we have to think about other ways to show that the care we're giving is effective. And we can do that in different ways. And that might be on things like monitoring pain scores and patients' assessment of their symptoms. It might be on doing patient or family surveys about their experience of receiving palliative care. But it's a really good point. And we really need to show with data that we've been effective in palliative care. So there's lots more to say about it, but I just wanted to mention that in response to your question. So I just want to say a big thank you to the speakers today. So thank you, Megan, and thank you, Tasnim, for some really clear and informative presentations. Thank you to all the participants for joining today, and for all the faculty as well, and all of your contributions. And it's really wonderful to see so many of you have joined up, and that you're dedicating your Friday evenings to learning more about palliative care. It's really encouraging, and I'm really looking forward to the coming weeks all together, as I know the other faculty are too. So our next session will be next Friday, the 4th of June. It will be at the same time at 8:30. And Tasnim will be sharing more about community-based palliative care, with a focus on setting up palliative care within the camps. And this is an open session, so we would love you all to join, but it's open to others as well. And the following week, we'll start with the sort of core modules for the course on June the 11th, and we'll post the reminders out each week in the WhatsApp. So we'll keep you up to date with the future sessions. Megan, Tasnim, do you want to say anything else before we close the session?
I just have one thing to say, which is if you're not Bangla speaking and you're joining, don't worry. There's enough in English that you'll be fine. And all the videos that we share, there will be an English version and a Bangla version. Okay, so if you don't speak Bangla, just watch the English version, but they're identical. They have the same slides. They just have different audio. So don't feel that you shouldn't join. We really would love to have you join as well. And most of our faculty, you know, there's enough that don't speak Bangla that everything's going to be bilingual. So thank you.
Thank you, Megan. Thank you again to everybody. And we look forward to seeing you all next week.
I think Saeed had a hands up.
Bye now.
Go ahead, Saeed, if you have an announcement.
Well, thank you. Invite you all to join earlier. If you have any technical difficulties, and at a time if 5 to 7 is having the difficulties, so it will be a bit tough for me to give you the solution. So we would like to invite you to join earlier. It will be better. And to join in the batch 3 WhatsApp group, where we will provide support, update, and every kind of information. So for the mentoring session, we will post in P. So thank you very much. Thanks to all our faculty members for your report. Thank you very much. সবার সাথে আবার দেখা হবে, ভালো থাকবেন, সুস্থ থাকবেন।
ধন্যবাদ, thank you, Saeed.
ভালো থাকেন সবাই. So please fill the survey this week. It's very important.
Okay,
we'll
good
share
night,
the link.
everyone.
Good night, Miridul. Thank you for your question.
Nice to see you again.
দয়া করে সার্ভেটা একটু কমপ্লিট করবেন। এইটা একটা আমাদের জন্য খুবই গুরুত্বপূর্ণ বিষয়, কারণ আমাদের বোঝা দরকার যে আপনারা কেমন চাচ্ছেন, আমরা যে ব্যাপারগুলোতে ফিডব্যাক চাচ্ছি সেগুলো সম্পর্কে আমাদেরও হচ্ছে আইডিয়া হবে। তো আপনারা একটু সার্ভেটা একটু কমপ্লিট করবেন দয়া করে, এটা আমাদের অনুরোধ আর কি।
Are you okay if I end the meeting for everybody?
Yeah, go ahead. Thanks, Megan.
Okay.